School nurses in Northeast Ohio say they do more than provide band-aids or ice packs. But not all students have access to a full-time nurse in their buildings. Should they? I'm Connor Morris with IdeaStream Public Media, and I recently visited one nurse at Bristol Local School District in Trumbull County to learn more about their work.
Ready? Oh my.
It's a busy day in Nurse Megan Soleil's office when we visit in early November. Tummy aches, bruises, and one student was accidentally hit in the head with a racket at gym class.
Do you have a headache?
No.
Are you sure?
Yeah.
Let me look at your eyes.
Nurse Megan, as the students call her, is the sole healthcare professional for Bristol's 550 students. While most students who come in just need to lie down for a moment or something as simple as Tylenol, there are more serious issues she tends to.
I hurt my knee too.
Kindergartner Isaiah stops in with something seemingly minor, but there's a good reason Soleil knows him well.
So Mr. Fisher is a hemophiliac who has a severe bleeding disorder.
Even something simple like a cut can lead to trips to the emergency room or hospital for Isaiah, who comes from an Amish family in the area.
The dog jumped up and bumped him, and he ended up in ICU for, how long were you in the hospital that time? A couple days, huh?
I was 2 days.
Soleil keeps an eye on dozens of students with more serious conditions like Isaiah's, and has to be ready at a moment's notice.
We have 1, 2, 3 seizure disorders. We have quite a few EpiPens. We have inhalers.
According to the National Association of School Nurses, only 66% of all schools have access to a full-time nurse. That number is 11% lower when it comes to rural schools like Bristol. Soleil says Bristol did not have a nurse before she arrived several years ago. Before that, students were getting aid from the front office assistants. She was placed there through a program at Akron Children's Hospital. Michelle Wilmoth, Director of School Health Services for Akron Children's, says they partner with 43 school districts in Northeast Ohio to provide school nurses. Schools pay the nurses per hour, and Akron Children's covers their ongoing training.
Been a gap in school nursing services in our area of the state.
Wilmoth says having this healthcare access in school buildings is a way to catch problems early and connect students to resources in the broader hospital system more quickly.
And so it really translates to better health in our communities.
It could be expensive for schools to pay for a full-time licensed nurse in every building, but there are other ways to approach school health needs. Katie Corrigan is the district nurse for Lakewood City School District. She oversees health aides who are not licensed or registered nurses at Lakewood's 12 schools, who she trains to administer medicine, do basic aid, and CPR. She thinks districts only need one licensed nurse.
You're way overqualified, way overeducated to be in a position all day long sitting in an elementary school or middle school or a high school.
Christine Rogan with the Ohio Association of School Nurses disagrees. She notes the National Association of School Nurses is calling for a bill to ensure there is a registered nurse at every school. She says her additional training and education as a registered nurse and as a licensed school nurse through the state of Ohio has been key in her job as a nurse at Orange City School District.
Being a school nurse is actually a specialty practice of nursing. So it does take sort of some additional knowledge and skill.
She says school nurses in general help reduce student absences. The majority of students are sent back to the classroom after visiting a nurse instead of home, so they don't lose learning time. And they provide vaccinations and vision screening. But there's another important aspect people often miss. Back at Bristol, 6th grader Callie visits Nurse Megan Soleil often. She has type 1 diabetes, so she checks in with Soleil frequently, who even helps her monitor things like carbs she can eat at lunch. It's not easy for Callie, but having Soleil to talk to helps. Her daughter has diabetes too.
Yeah.
We don't always talk diabetes. Actually, that's probably the least that we talk.
Yeah.
So just talk about what's going on in life. And
Basically, anything and everything.
Sometimes being a school nurse is about more than just physical health, Soleil says. It's about providing a reassuring presence to students to know they always have someone in their corner. Connor Morris, IdeaStream Public Media.